All right, good morning, everybody. So wonderful to have you here. My name is Michael Perlitsky. I'm Executive Vice President for RWJBarnabas Health and Interim President and CEO for RWJBarnabas Health Medical Group. So it is my honor to introduce this incredible facility to all of you and, of course, to the patients that come here and will come here. And, of course, thank all the folks that were responsible for making this happen. And I hear one of them right now. It is 22,000 square feet of incredible space, of patient-oriented, with the highest technology possible, and enabling what we feel are the best clinicians in the state by far and nationally as well. Today we're going to hear from some of those physicians because, again, without them, none of this is possible, none of it is worthwhile. We're also going to hear from the mayor of East Brunswick, who is here today, Mayor Brett Cohen, and of course from the president and CEO of the health system, whose vision continues to drive this project and many more. First, I want to acknowledge some elected officials who are in the room. Assemblyman Sterling Stanley is here. Assemblyman Robert Karabinchik is here too. Ronald Rios, Commissioner Director, Middlesex County. East Brunswick Council President, Kevin McCoy. Dana Zimbicki, East Brunswick Council Vice President. And Dana Winston, East Brunswick Councilwoman. At the end of today's remarks, we'll also offer tours of this wonderful facility, and we left some breadcrumbs in case you get lost. Again, this is a very, very large, impressive space. Before we continue with the remarks, and before I bring Mr. Mark Madigan up to speak, I do want to acknowledge some key contributors to this wonderful space. First of all, the team from Rendina, who located this space, who identified it, and who developed it for us. Thank you, Rendina. I mentioned it before, but it's worthwhile mentioning it many, many more times. I want to thank all the orthopedic providers who make this thing happen, and Allison Saporita. We all know what happens the first day when something like this opens, right? It's rough. Things may not go perfectly, but guess what? They did. And over 100 patients were seen here the first day because of the operations team, because of the medical group staff, and again, because of our wonderful physicians. I want to acknowledge Children's Specialized Hospital and Rutgers Cancer Institute as well, who will be offering services at this location too. Because at the end of the day, this is not just orthopedics and pediatrics. This is an ambulatory hub for the full community, for all needs. RWJBarnabas Health's vision is this one-stop shopping for all needs of our patients and our communities. That's why we have these 22,000 square feet of state-of-the-art space. I do also want to call out Dr. Andrew Bowe, who is going to come up later on to speak. He was instrumental in helping us be recognized as one of the nation's best children's hospitals for 23-24 in U.S. News and World Report and Bristol-Myers Squibb Children's Hospital at Robert Wood Johnson University Hospital, ranked number 34 in the nation. So with that, again, I don't know about you guys, but I'm just blown away by the space, by the cutting edge technology, and everything that's happened here, even in the last several weeks, but more importantly will happen for many, many years to come. And with that, I'd like to welcome Mr. Mark Madigan, President and Chief Executive Officer, RWJBarnabas Health System.
Good morning. Thank you, Michael, for the kind introduction. It's terrific to be here to celebrate the latest expansion of our services in Middlesex County. As Michael did, I want to thank our partners in government, from the town, the mayor, the council members, our friends in state government, county level government. I say partners because we share the same goal you do. That's to make the lives of the people in the communities we serve better. And that natural alignment brings us together to produce incredible facilities like this at the end of the day in service of a mission to make the lives of the people in this county healthier. And that's a noble mission that we share with you, so thank you for that. As Michael said, at this facility, we'll offer a wide array of technology-enhanced, coordinated care, pediatric orthopedics by a nationally ranked pediatric orthopedic program. And thank you, Dr. Bo, for your leadership. Pediatric rehabilitation services through Children's Specialized Hospital. You're going to hear from Matt later. Really one of the most terrific programs we provide. It is a statewide program that has national recognition, incredible services being provided there. Women's health, in conjunction with our partners, Rutgers Cancer Institute in New Jersey. We've made significant investments in cancer throughout the state, have recruited over the last 6 years 65 subspecialists to provide and enhance the level of cancer care we provide in the state. It's the #1 cancer program in the state of New Jersey, and we'll extend those services here. Our ambulatory partners, New Jersey Imaging Network, JAG Physical Therapy, they're nearby, again, lending to that full menu of coordinated care. Boston Orthotics and Prosthetics, a kind of a critical component to comprehensive, coordinated pediatric rehab and pediatric orthopedic services. And I think we're just getting started. We envision hubs like this throughout the state where we're providing primary care, coordinated special care, academic-based coordinated health care, improving the lives of folks throughout New Jersey. And we're really, really proud of what we're doing in children's health. We have the most significant and extensive pediatric care network in the state of New Jersey. We continue to invest in it, and we will continue to grow it so that no one has to leave the state of New Jersey, and ideally, no one has to leave their community to get the best care for their kids. I'll take that. Thank you. I want to thank all the folks who made this happen. Allison, Dr. Bo, Matt McDonald, Bill Favazzani, who leads our children's services, Suzanne Spurnell, our partners, NJ Imaging, JAG Physical Therapy. But I also want to thank the folks who answered the phones here, the techs, the nurses, the clinicians, the doctors. Without those folks, there's no building here. Without those folks, there's no RWJBarnabas Health. There's no mission. So thank you very much. It's a terrific day. RWJBarnabas Health is in and of this state. We live here, we work here, we invest here, we take care of people here. We love the people of New Jersey. We love the people of East Brunswick and Middlesex County, and the opening of this patient care location is a tangible expression of that commitment. So I want to thank you all very much, and I look forward to the rest of the program. Michael, am I passing this back to you to MC? So we have you throughout this whole program?
Yes.
My apologies in advance.
And Mark, I appreciate your support, continued support for many years to come.
We'll see.
Thank you for that. All right, so next we have the easy one. We have really our host here and representative of the community, our next guest, the mayor of East Brunswick, Brett Cohn.
Well, good morning, everybody. This really is a very exciting day, and I think that what I'd like to do is talk a little bit about how we got here, because when I took office about 7 years ago, this was a dying Kmart. Most people might not know that, but that's what this building was. And one of our visions for redeveloping and having a vision for what Route 18 would look like in a in a new age was, what is that going to look like in a world where retail is really something that was a dying breed? And I remember getting a phone call from the Home News asking me what I thought about the fact that there was an announcement that Kmart is closing. And I said, thank God. And the person who interviewed me wanted to know why I was being so unempathetic for people who would be losing jobs and moving on. I said, well, have you been in East Brunswick? The place has been contracting for years. Employees have already moved on to other places. It was just a matter of time. But the markets move on, and it will figure out what the next stage is in its evolution. And that brought us to Carrie and Fran Teifel, and I want to give credit for Fran, who is the owner of this building here, for having the ability to sit down with the township and figure out together as a team what this could become, and bringing to us renters and people who would look to move here to East Brunswick that augmented and fit with our vision of what that would be. And I thank her for that, and I thank the team for that, because we did, I think, end up in a much, much better place. I also want to thank Robert Woods, the foundation. I want to thank the administration and its board for seeing what we in East Brunswick always knew. Route 18, East Brunswick, first of all, sits at the center of New Jersey. The center of New Jersey. We're not the geographical center, that's Hightstown, but the actual statistical center where most people live is a little bit more north and a little bit more east than Hightstown, and it puts you right in East Brunswick. You're on a corridor that sees over 100,000 cars a day. It is a major place. We have a huge medical corridor that existed here for a long time. I'm a physician myself. One of the reasons we moved to East Brunswick, my wife and I are both physicians, was because of its proximity to Robert Wood and St. Peter's. I'm an OBGYN. I need to be close to the hospital. And so as a result, many medical professionals, people in healthcare industry have moved to East Brunswick to settle here because of its proximity to these major hospital centers. Cranberry Road is a major medical corridor. It's dubbed the Medical Mile. There are thousands of medical offices and healthcare facilities that exist right here. So I thank you for recognizing that and moving this tremendous facility right here in East Brunswick. I'm impressed at the size of the building and its ability to be able to service patients, which is near and dear to my heart, because we are a very densely populated state. And so being able to get to healthcare where it's closest to where it's being delivered is critical. Because of our density, because of traffic, you could live and go to a facility that's in the next town that could take you a half hour. So I think that I applaud your vision. It's definitely is the same vision as we have here in East Brunswick. And on behalf of the township, both President Kevin McAvoy and Vice President Dana Zimbicki are here on behalf of the council. The town welcomes you here and wishes you the utmost success.
Thank you, Mr. Mayor. And as Mark mentioned, as the mayor mentioned, RWJBarnabas Health is committed to our communities, and that's where we're headed. We're going to all these ambulatory hubs, to all the locations, so folks don't need to travel for the best care. Next, I'm very happy to introduce, to welcome Dr. Matt McDonald, President and CEO for Children's Specialized. Matt?
Good afternoon, everyone. I'm thrilled to be here with all of you. Mark Manigan talks about values and leading through values at RWJBarnabas Health, and we embrace our values at Children's Specialized as well. Today, I think that the value of focus would be teamwork. And I was prepared to talk about teamwork. I look at the extensive team that we have here. I didn't know that we were going to rig the run of show such that we would actually have the OBGYN handing off to the pediatrician. That just came to me. At Children's Specialized Hospital, we pride ourselves on being the nation's leading pediatric rehabilitative hospital in the country, and it gives me a great sense of pride to be able to deliver that service right here in East Brunswick, right here in New Jersey. In the state alone, there are about 250,000 children who have a special health care need. Children's Specialized Hospital proudly serves approaching 40,000 of those children. But we're on an unrelenting journey. We know that children continue to have unmet needs, in particular difficulty accessing services that they need. This facility here in East Brunswick will help to close that gap considerably. There's more than one beautiful person in this room, but the most beautiful people in this room, to me, obviously, are the little children over there and their families, the folks that at Children's Specialized and across our system we're dedicated to serve. One particular little lady in there is an 18-month-old beautiful little girl with her hair done perfectly. Her name is Nyla, and she's here with her mom, Genesis. Genesis, can you raise your hand and say hello? Nyla was born with a condition called lissencephaly, which is effectively a smoothing of the brain where the brain ought to have contours and grooves. And because of that, she has some developmental delay, and she's also affected by a significant seizure disorder. And the beautiful part about today is that when we opened our doors, Nyla will be able to have access to the nation's leading pediatric PT, OT, speech, feeding therapy. And as she continues on her journey, she'll have access to rehabilitative medicine, psychology when she gets older and rolls her eyes at her mother, psychiatry, the full gamut of what we offer at Children's Specialized. And we take very seriously the privilege it is to be entrusted with the unbelievable honor to help her on her journey toward her full potential. And I hope that you'll share in the celebrations of her milestones as she continues in her journey, knowing that each and every one of you, through teamwork, brought this day to fruition. You've heard a lot about it already. I won't belabor it. But whether or not your name is Mark Manigan or Tom Biga or Bill Farizani, Chuck Giannis and Patty Foley at Children's Specialized, and onward, we will all share in Nyla's celebrations as she continues to reach her milestones. And that, amongst other things, is what today is all about. Similarly, on the topic of teamwork, the beauty of this facility is that we have teamwork embedded right here. So when Nyla needs services that are outside the scope of what Children's Specialized is offering, we can send it right up the hallway to the state's leading pediatric orthopedic center by way of example. And that's a beautiful thing for those beautiful kids. Along those lines, I'm going to bring to the podium Dr. Andy Bowe, and he's going to tell you about pediatric orthopedics. Thank you so much for your support.
Well, I am humble and honored to be here, and I certainly look forward to our collaboration with Children's Specialized, because as Matt just stated elegantly, I think it will only benefit the children in this state. I think it was about 3 years ago, Josh called me and he was very excited. He said he had a piece of property on Route 18 that would hopefully be the new home of pediatric orthopedics, or what we call POA, because we would be able to, under one roof, combine our two offices in East Brunswick. And here we are, it's come to fruition. And there are numerous people to thank, and that's already been done. But I'm delighted to be here. I think we as a group have worked really hard to not only be the best pediatric orthopedic group in the state, but also one of the best in the country, as evidenced by our recent ranking of U.S. News and World Report of being 34th in the country. And we're a small hospital, and I'm very, very proud of that. But this isn't about me, this is about our group. And I think that we've not only worked hard to provide all aspects of pediatric orthopedics, but to provide them with expertise and cutting technology. And I think even more important is we do this with compassion, understanding, and ultimate care of our patients. I think that we cover the full gamut of pediatric orthopedics. We take care of congenital problems, hereditary problems, spinal deformities, hip disorders, growth-related issues, sports injuries, hand and upper extremity problems. And I think that this is something that we've worked very hard at. Years ago, my senior partner, who actually started pediatric orthopedics in the state, Dr. Skip Lawfer, told me that if you surround yourself with caring, competent people, you can build a wonderful program. And I think that that's what we've done. And this isn't about me. I've heard a few accolades this morning, but this is about our group. And I need to acknowledge these people. I'd like them to maybe at least stand up. You know, Dr. David Weissman, right here. David is our traumatologist. He's probably seen more fractures than maybe all of us together. Where's Dr. Tom McPartland? He always stands out. Tiny Tom. He's not only very instrumental in the orthopedic residency and promoting education, not only on a state level, but on a national level. He has developed a wonderful hip preservation program that is unique in the state. Where's Dr. Harnley? Heather? Leads our sports program. Heather's actually dual fellowship trained in both pediatric orthopedics and sports medicine. And where's Matt Parisi, who's recently joined Heather, are complementing our sports program. Dr. Adelson has been with us for many years. And Dr. Alex Lopian, who recently joined us, have both been instrumental in further developing our spinal deformity program. Last but certainly not least, I think we all know Dr. Deidre Belicka, who has single-handedly developed one of the most comprehensive and best pediatric hand and upper extremity programs in the region and in the state. So I think that I would like to acknowledge them more than me. And I think I would be remiss if I didn't mention a few other people. I know Allison Saporino has been mentioned before. But I think everyone, to a person who works in this office, knows how hard she has worked and her dedication. And I will tell you that she personally was responsible for getting us into this office on a timely fashion. As a matter of fact, if it wasn't for Allison, I'm not sure we would be here today. She's had some very helpful lieutenants, Jean Pagano, Zarish Khan, Maria, and I think that it's, as she would probably admit, and has been mentioned before, we could not work in this office if it wasn't for the MAs, our x-ray techs, our PSRs, our athletic trainers, our nurses. And I can't thank them enough, because they're the ones who enable us to do what we want to do, and that's taking care of patients. I think I'm excited about this facility. What's not to be excited? But I think that what I'm most proud of is our new x-ray. We have what we call an EOS machine, which is a new and state-of-the-art x-ray machine that not only delivers very precise imaging, but does it at about 75% less radiation. And that is for patients. I think I have forgotten to maybe acknowledge also somebody who's probably in our group been the one who keeps us all together. I think I saw Colleen Donovan somewhere. Where's Colleen? Colleen is our nurse practitioner. She takes care of our patients in the hospital. She's very much involved in our spinal deformity program. She is the one who collects a lot of the data with the U.S. News and World Report, which is essential. And along with that, Kelly's back there, and Kathy Hipschman are also very involved in the U.S. News and World Report, which is something that obviously we're very proud of. I look forward to all of our new and existing patients and welcome them to this facility. And I look forward to continued pediatric orthopedic excellence that we deliver not only in the community, but in the state. And once again, I'm humbled to be up here amongst such dignitaries. Thank you very much.
Thank you, Dr. Bowe. And as you wander around the 22,000 square feet dedicated just to pediatric orthopedics today, that's fully opened, keep in mind that what we talked about in some of our remarks, this ambulatory hub, all in, is actually over 50,000 square feet. That's coming up next. So with that, we're concluding our formal program again. There are tours available. Please take advantage, and thank you for coming.